The first event for the Biopsychos Going Social Group will be held in Belgrave in March. This event will then be repeated again in Wheelers Hill in May. Dangers do exist. During the Enigma of Pain, which is the first presentation, we'll talk a lot about pain being overprotective, that pain is not a true reflection of the state of the tissues. But we've always got to remember, dangers do exist. And I remember back to uni many years ago, I had a fantastic lecturer called Tibor Boka, who came in one day and said, if someone comes in complaining of a stabbing pain in their back, firstly check they haven't got a knife in their back. I'll now run through 4 case studies of people that I've seen here in the clinic. Over the years, I've actually seen about 10 serious pathologies where I've been the primary practitioner to come across them. Out of those 10, only 1 survives till this day. The flag system was first released in the mid-90s and is still very relevant till this day. One of the most important flags are the red flags, which are possible signs of a serious pathology. Signs we are looking for are night pain, history of cancer, bowel or bladder dysfunctions, lumps that are rapidly changing, sudden weight loss, or rapid changes in the bodily systems, and also when things just don't make sense. They could be pointing towards things like cancers, neurological disorders, systemic disease, quarter equina syndrome, and the list goes on. The first case study I'm going to run through is of the beautiful Tara. This is probably the one that affected me the most. She was the same age as me. I'd been treating her for about 6 to 8 years, and we'd got on really well. I saw her for the occasional lower back pain and stiffness, and usually it resolved within 1 or 2 sessions and she was back doing her work as a hairdresser. Then one day she came in and I was palpating through her lower back. She had a mild ache but nothing really out of the ordinary, and I found a lump which was about the size of a small fist in her quadratus lumborum on the left side. It was soft, it was squishy, and it felt very much like a lipoma. I wasn't really happy that it had come up in the last month, because a month previous I did not notice it when I was treating her back. So I referred her on to her doctor to get it assessed, and I was expecting to come back as being a lipoma. She messaged me a week later, and it was a Ewing sarcoma. And I sent her a message back saying, my heart goes out to you. If you need anything, please let me know. And I never heard from Tara again, and she died 6 months later. The next case study is of a guy who came to see me about 3 years ago, and he'd just retired. He was a man that had never suffered with a headache throughout his life, but over the last 3 months he had this deep boring headache that was constant, and at night it was worse. He'd already seen physios, osteos, his doctors. No one was able to give him any relief. On assessment, I saw that his upper trapezius on the right side was this quivering protective spasm. Because of the nature of the pain, because of the muscle spasms that I was seeing in the side of his neck, I wanted him to go to his doctor and get an MRI, and I wanted it done urgently. So he messaged me back about a week later, and they said they'd found a glioblastoma. Now this is quite an aggressive brain tumour, and he died 3 months later. The next case study I'm going to run through is of the piano man. He came to see me with bilateral forearm and hand pain. He was an anxious type character and catastrophised about his pain a lot. He tuned pianos for a living, so the forearm pain, hand pain, it was all making sense to me. But over about 6 treatments, we didn't see any improvement. So I referred him on to his doctor. I didn't hear back from the doctor for 6 months, but then one day I bumped into her and I was chatting to her about this patient. And she said she saw his tongue was being very lazy when he was talking to her, and his speech wasn't being controlled as well as what it probably could be. Straight away she knew what it was. It was motor neurons disease. So this was a challenging one for me because the assessment made sense to me, but then the treatment wasn't working. So when things don't make sense, sometimes refer them on to get explored further. And he died last year. Now the last case study I'm going to run through is of my mate Davo. Now Davo I'd known for many years, and he'd always suffered with intense migraines and headaches. He was under the care of a neurologist who had been looking after him since his early teens. When I saw him in the clinic, and this was actually 16 years ago, Davo was only 19 at the time. And he saw me over a few sessions, and we saw mild reductions in his headaches and his migraines that would last for only a couple of days, then the symptoms would come back again. Then one day he came in and said that he'd lost strength in both hands. So I did some testing, and I found that he was weak across multiple myotomes, there was altered sensation across multiple dermatomes, and his reflexes were diminished. So I wasn't really happy that this change had happened just in the last 24 hours. So luckily he had an appointment to see his neurologist the next day, and I asked him to move that appointment forward if he could to that same day. So we got in to see his specialist, who booked him in for an MRI. And the MRI showed that he had a vascular malformation of his spinal cord in the cervical spine that was actually wrapping up the spinal cord and was actually strangling it. He was only possibly 2 or 3 days away from being a quadriplegic. So he was in having surgery that night, and they removed this vascular malformation. Davo got through the operation all right, and his recovery was good. But I hadn't heard from Davo in the last 16 years, so I thought I'd give him a call, just to check in on him to see how he's going. And Davo is now married, he's got 2 kids, and he's working as a carpenter. He's only got a very small deficit in his hand strength, but on the whole, he's doing really well. His migraine headaches are virtually non-existent now. So for me, this was a really powerful one because it was a friend of mine, and I was only in my first 3 months of working at the clinic. So serious pathologies can come in either in the first month or it might happen today. So always be on the lookout for these conditions. So thank you for listening to these case studies of serious pathologies that I've come across in the clinic. Unfortunately, I have come across a lot of these conditions. So remember, dangers do exist, and I will be running through a few other case studies in the Enigma of Pain talks, which will be coming up during the year. Thank you for listening.